Focus tonight, a heroin epidemic is sweeping our state. Governor Larry Hogan signed 2 executive orders just last week establishing a coordinating council and task force to study this growing problem. At a time when effective addictive treatment center is more needed, one of the biggest drug treatment centers in our state is in danger of closing down for good.
Kelly, it all has to do with a little-known Medicaid rule. Now, inpatient treatment providers must change the way they operate or not be paid by Medicaid.
I've seen too many people die over there. And I've seen a lot of people's lives being saved.
Peter D'Souza's eyes well up with tears at the thought of Hope House treatment centers potentially closing. Established in 1983, the 2 centers provide detox, inpatient, and intensive outpatient drug addiction treatment in Crownsville and Laurel.
From the 1st of January, all the money has stopped coming in.
D'Souza is not sure how much longer he can go on. 95% of Hope House's clients are on Medicaid. Now, Medicaid will not pay for inpatient drug treatment for adults 21 and older. It's the cornerstone of Hope House's programs.
I know that they respond to the treatment and that it works. And we have proof that it works in the lives of the people around here.
People like Angel Trainer.
When I came through the doors of the Hope House, I was a full-blown heroin addict.
Before arriving at Hope House in 2007, Trainer lived a life of addiction for 33 years.
I had been through several outpatient programs. I had been through several psychiatric units. I had been in and out of jail, and none of that made a difference. None of that changed me. But coming in here was a life-changing experience for me.
Patrick Matthews also credits Hope House's residential program for keeping him clean for the past 9 months. He'd been addicted to drugs and alcohol for 26 years.
3 days of an outpatient detox, you're very sick. Once you get kicked back onto the street, you're going to be in too much pain physically, mentally. Most of the time, we're just going to run back to what we know, and that's drinking drugs.
Between its 2 facilities, Hope House has 87 beds. Under a federal law known as IMD exclusion, Hope House would have to cut down to 16 or fewer beds at each location to be eligible for any Medicaid payments. D'Souza says that would essentially shut them down, leaving even fewer drug treatment options in the community.
We are dealing with life and death issues. I know that we are going to have many more deaths than what is happening right now.
In 2014, there were 308 overdoses in this county, and 48 of those were fatal, nearly a fatality a week from heroin.
Last month, Anne Arundel County Executive Steve Shue declared a public health emergency due to the spike in heroin-related overdose deaths and the dramatic rise in people seeking treatment for opiate addiction in the county. Shue's office is working with the Department of Health and Mental Hygiene to see if there are any county and state funds available to ensure that those in treatment will be able to continue it. But that would only be a short-term fix. A change in Medicaid policy would have to come from the federal government.
I think the best chance for anybody that's willing is an inpatient program, surrounded by people that care, that absolutely care. It gives you every chance to succeed.
I encourage everybody and anybody that has a voice to stand up and say this, but we have to have it. We have to have one voice. We have to have one message. And that is, that is the message that recovery is possible, that there are many different pathways. Treatment is effective. It is effective.
A spokesman for County Executive Shue says he has also written a letter to U.S. Senator Barbara Mikulski and has been in touch with Congressman John Surbanes on the issue. But he adds that Hope House may have to change the way it operates to ensure that it is sustainable. That could mean cutting beds or going to an outpatient model of care. Meanwhile, D'Souza estimates he only has a few weeks left operating on reserves if nothing changes. And Kelly, that means 99 full-time and part-time employees could lose their jobs.
So not just the beds, but the employees that work there.
That's right.
With so much emphasis in this on our state, from the governor on down to the different counties, this is going to be such a loss for so many people that have benefited from this.
Right. We heard from 2 of them there in the package, and particularly Angel Trainer, you saw was one of the many success stories out of Hope House. She actually now runs Serenity Sisters Recovery Homes for Women, which provides transitional housing for these women just out of drug treatment. So really a complete 180 from where she started.
Wow. Well, we'll see. We got time yet. Hopefully things will turn around.
That's right.
All right. Thanks a lot, Trey, for that report. Well, just this afternoon, Anne Arundel County Executive Steve Shue released an action plan to address the county's heroin crisis over the next decade. The county's Heroin Action Task Force includes law enforcement, educators, doctors, and judges all involved in it. The plan has a three-pronged approach to combating heroin: education through public awareness campaigns and community engagement, expanding and investing in treatment programs, and increased enforcement targeting gangs and heroin dealers.